Tonight on Living in Omaha, the plight of children in Douglas County. According to a recent report, an alarming number of our youngest residents are living in poverty. We'll hear from two local authorities who deal with this issue in Douglas County. Then we'll see how the cycle of poverty continues when children begin having children. Stay with us.
Living in Omaha is funded in part by over 33,000 people like you, who are members of Nebraskans for Public Television.
Welcome to another edition of Living in Omaha. I'm Marlene Ong. We often hear that there are more children living in poverty than ever before. Well, the statement still holds true today. But what does that mean to society? We'll begin with a background report that examines how living in poverty can affect our children's health and our community. One mother dreams of buying her children decent clothing from the thrift store. Another says she makes too much money to qualify for any help, but not enough to live on. While a third describes difficult financial times. Both she and her husband are working, but still find it difficult to make ends meet and provide for their young children. These scenarios are taken from the 1993 Kids Count in Nebraska report. It provides a picture reflecting the growth and development of Nebraska's children. Although there are some good discoveries, much of the findings were grim. So how did Douglas County rank in Nebraska regarding its children? Well, we did fare better than most counties, but our community can improve conditions for our children. One of the major findings for Douglas County is the number of children under 5 living in poverty increased nearly 40% between 1980 to 1990, while the rate of poverty is much higher for children of color than their Caucasian counterparts. At highest risk are African Americans and Native Americans.
Unfortunately, the children that are born into poverty are going to have so many disadvantages surrounding them that the vast majority of them have great difficulty overcoming them and breaking out of the cycle. I think it's our responsibility to try to provide all opportunities possible to help these people help themselves.
Some of the things in the welfare system that have encouraged people to stay on the system and discourage them from getting off the system and going to work and actually punishing them for finding jobs. We have, I think, 1,200 to 1,400 people going on to the Medicaid system each month in Nebraska. Medicaid costs are driving the state budget. The welfare system needs to be a hand up, not a hand out.
Sister Mary Kay says nearly 98% of her patients at the South Omaha Health Clinic live in poverty. She says the center saves taxpayers money by providing preventive health care.
Prevention is always less expensive than treatment. So if you have a child who needs something, or you can prevent them from needing something, it's going to be less costly to society. People don't have access to health care. And when they don't have access to health care and they have very limited incomes and they're worried about getting food on the table, then preventative health is not a big priority. Most of our clients have somebody in the family that's working. They're usually underemployed, but they're working, or they're working part-time, and so they don't have health care benefits.
Such is the case with his 26-year-old mother. She and her husband would like to be off government assistance, but can't afford to because of his meager salary. She says her daughter had a healthy beginning because of free visits to the Indian Chicano Health Center. When asked about the future, Mrs. Dominguez admits she has hopes for her daughter.
I would like my baby to grow up and be healthy and get to be someone, and hopefully one day return to Mexico.
Well, as a community, I think we have a lot of responsibility for children who are in poverty, because that's our future as a nation, our future as a civilization, and when we have compromised children, then we're going to have an extremely compromised society. So it only behooves society to take care of children. They are our future.